Good morning. I am Joy Edwards, and I am a senior at Childs High School here in Tallahassee. And I am so honored to be here to serve as the 2012 moderator for the Teens Only Town Hall meeting. I would like to thank Governor Rick Scott and welcome Secretary Wilkins, Chair of the Children and Youth Cabinet, along with all cabinet members, our Youth Commission, and our audience. We are very excited to have you with us today. Youth are able to participate in the political process through certain school functions and other events, yet rarely are their voices ever heard. Now, more than ever, youth are choosing to get involved in issues that affect them. And today, Florida's children and youth will present issues most important to them and their families. The Children and Youth Cabinet was signed into law on July 11, 2007, and the Cabinet consists of 20 members and coordinates state agencies and programs that deliver children's services, with the vision of all children in Florida growing up safe, healthy, educated, and prepared to meet their full potential. The Cabinet was created to promote interdepartmental collaboration and program implementation in order to improve the overall self-sufficiency, safety, economic stability, and quality of life for all children and youth in Florida. Joining us today from the Children and Youth Cabinet are Representative Gail Harrell, Executive Director Alan Abramowitz, Guardian ad litem, Justice Barbara Pariente, Florida Supreme Court and Chief Justice Designee, Director Michael Hansen, Agency for Persons with Disabilities, Dr. Judy Schechter, Governor's appointee, Secretary WANSLEY Walters, Department of Juvenile Justice, Secretary David Wilkins, Department of Children and Families, and Chairman of Florida Children and Youth Cabinet, Steve Ufelder, Director Cindy Odom, Office of Adoption and Child Protection, Executive Office of the Governor, Commissioner GERARD Robinson, Department of Education, Berkeley de la Rosa Puente, Attorneys General's Designee, David Lawrence, Governor's appointee, Director Mel Gerardo, Office of Early Learning, and Surgeon General Frank Farmer, Department of Health. Each year, numerous outstanding students are nominated from high schools across Florida to serve as youth commissioners. However, after a careful selection of process, the 12 students are chosen to serve in this capacity. The Florida Youth Commission represents youth across the state and as an advisory body to the Florida Children and Youth Cabinet. The Youth Commission is committed to reaching out to other youth across the state to gain a better understanding of the various issues facing Florida's next generation. Today, these commissioners will pose questions to the Children and Youth Cabinet that will cover a wide range of current issues, and each question has been thoroughly researched and prepared by the students themselves. I am pleased to introduce the 2012 Teens Only Town Hall Meeting panelists. We have Emily Gildersleeve, 12th grade, A. Crawford High School from Lynn Haven, Florida. We have Matthew Morse, 11th grade, Lincoln High School in Tallahassee, Florida. Alexa Parsons, 11th grade, Creekside High School, Jacksonville, Florida. Rachel FLOYD, 11th grade, Sunlake High School, Tampa, Florida. Nathan Meeks, 9th grade, Citrus High School, Lecanto, Florida. Angeline Pino, 12th grade, International Studies Charter High School, Miami, Florida. Josh Schnyrov, 11th grade, Pinecrest School, Plantation, Florida. Hannah Carey Meepoor, 11th grade, Lawton Childs High School, Tallahassee, Florida. Tina Huang, 12th grade, Dr. Phillips High School in Winter Garden, Florida. Kalfani Campbell, 11th grade, Alonzo and Tracy Morning Senior High in Miami, Florida. Alan Catt, 10th grade, Timber Creek High, Orlando, Florida. And Grant Gaston, 9th grade, Booker T. Washington, Pensacola, Florida. The meeting process will be as follows. Questions will be delivered to the cabinet members by each youth commissioner, and they will have 1 minute to pose their question and state their specific question to the cabinet. Cabinet members will then be given 1.5 minutes to reply briefly, but as thoroughly as possible, respond to the question. Keeping time in mind, I will recognize additional cabinet members to fully answer the question and address the issue. When all questions have been answered, additional questions may be posed depending on the availability of time. Our timekeepers are seated in front of the cabinet, and they are using stopwatches and will hold out the 15-second and stop signs. We ask cabinet members to please adhere to the stop sign. Our time for this meeting has been carefully laid out to ensure that all youth have an opportunity to pose their questions. We ask the audience to be courteous and respectful and to please turn off all electronic devices and to hold all comments and questions until the audience participation portion of our meeting. We have provided question cards to all youth audience members who will have the opportunity to develop and direct their question to the cabinet later in the meeting. Please complete the question card and give it to one of the volunteers in the back area. They will then submit your questions to the coordinator, and you will be directed to come forward and pose your question to the cabinet at the end of the meeting. Please be considerate toward the student panelists and cabinet members. Now that the rules have been settled, let's begin the 2012 Teens Only Town Hall meeting. Commissioner Emily Gildersleeve, please pose your question to the cabinet.
Healthy Start coalitions are nonprofit organizations that work to mainly reduce infant mortality, which has always been viewed as an indicator of a community's health and quality of life. Healthy Start also works to reduce the number of low birth weight babies and help mothers with high-risk pregnancies receive the care that they need to have a healthy pregnancy and baby. In 2010, Healthy Start was able to help over 210,000 pregnant women and children who had been identified as at risk for suffering a premature birth, infant death, or other poor birth outcome. The March of Dimes reports that the cost for a healthy baby from birth to his first birthday are $4,551. However, for a preterm baby, the costs are $49,033, 10 times as much. In 2011, Healthy Start suffered a $5.4 million budget cut. As a result, it was estimated that 22,600 pregnant women and children did not receive vital prenatal care. In the 2012-2013 budget proposed by Governor Scott, the spending has been restored and Healthy Start coalitions will be able to help these women again. My question to the cabinet is, what will your agencies do in the coming months to assist Healthy Start coalitions maximize their resources and their ability to serve as many women and children as possible so they receive the help that they need?
I'll answer part of that question. I'm Frank Harmon, the Surgeon General that overlooks some of that program. As you outlined in your pretext before the question, it's a very valuable program. It offers great services, and we're going to do everything we can do to maximize the amount of money that we get. And what we've done, we have cut down the administration. We have tried to keep the money for the direct services for those children and those pregnant women in order to maximize the money. We're all living, of course, in a time which we have reduced resources and carry out the mission. But in order to carry out the mission and maximize, as you pointed out, the great good that it does, we're going to look at more of the administrative side. We're going to reduce the administrative side and try to keep the direct services to these pregnant women going as much as possible.
Thank you. Do any other cabinet members have anything else to add?
If there's more time for that. Yeah, I think that I'm glad we're going to do all we can to reduce the administration and try to do the best we can to fully fund it. But I think that the question you asked makes the need for such a program crystal clear, and the economics of why we ought to do it crystal clear. And if we want to reduce costs of things such as Medicaid, which is a priority for this administration and for our budget, then this program absolutely ought to be fully funded, because the cutting back things such as Medicaid make absolutely no sense unless we do the prevention up front. That's where we do our savings.
Thank you for that. Do any other cabinet members have anything else they would like to add? No? Okay. Thank you. Commissioner Matthew Morse, please pose your question to the cabinet.
Human trafficking is the exploitation of people for prostitution or forced labor. In Florida, many victims of trafficking are children and youth. And these youth often come from unstable home environments and are taken advantage of by pimps and other criminals who abuse them. There are an estimated 200,000 American children at risk of sexual exploitation, and Florida is the state with the third most reported trafficking victims. I'm thankful that January has been declared Human Trafficking Awareness Month, and I understand that the Cabinet is addressing this important issue with the Human Trafficking Work Group. And yet, male victims of human trafficking have been largely ignored. Not much is being done to help them, at least not as much as girl victims, nor is there much research about young male victims. Additionally, many victims are also involved with child labor trafficking, which an issue that is not as widely recognized. Labor trafficking of youth involves children or teens being exploited for forced, cheap labor, such as begging, door-to-door sales, and as field workers, among other settings. I'm sure that we all can agree that there's more to do to solve this important problem. On that note, what do you and the Cabinet plan to do to end labor trafficking of youth and to increase services and research to help male victims of child trafficking?
Representative Gail Harrell, you have 1 minute and 30 seconds to respond.
Very much, and before I begin, first of all, I want to say thank you to all the wonderful students who are here today. You are the future of our state, and the fact that you've come all the way to Tallahassee, you're participating in this youth conference, youth cabinet, is absolutely commendable, so thank you for what you're doing. To address the trafficking issue, this has been an issue that this legislature has addressed several different times since about 2004. I'm part of a national organization called the National Foundation of Women Legislators, and we spearheaded legislation across the nation, including Florida, to begin looking at trafficking. It was an unknown crime, certainly, or not unknown, unidentified by law enforcement. And law enforcement didn't have the tools to really deal with it. And we started in 2004 and 2005 to begin addressing the issue, defining the issue, and to look at it. Unfortunately, we found that those laws we put in place haven't been used. There's only one person in the state of Florida who's actually been convicted since those laws were put in place. So this year, the legislature has made an endeavor to really look very carefully. And I have to commend Representative Snyder, who happens to be from my area as well, and the two of us really looked at this. And he was the spearhead of this, along with Attorney General Pam Bondi. And we have a proposed committee bill that passed out of the Judiciary Committee last, I guess, about 2 weeks ago. And it is going to be moving forward. It's a total rewrite and revamp of our trafficking laws, addressing labor trafficking, addressing sex trafficking, boys and girls, and really looking at and putting in force very strong laws that will be able to address the issues. Along with education of law enforcement, that's a key component of it. And it's going to be a terrific bill. I would ask you all to go and lobby your local legislators on it. Thank you.
Commissioner Morse, great question. I think you asking the question is part of the education that youth are asking these questions. I would like to salute David Wilkins. I don't know if people know it, but their hotline actually has a maltreatment, the only one in the country that is human trafficking, children trafficking, boy or girl. And it's the only one in the country, and law enforcement's trained on it. So when people suspect abuse, they can actually call the hotline, and there will be an investigation. And to recognize that, because oftentimes these children look like perpetrators. They might be arrested for prostitution. And I think there's a realization coming from the leadership of children and families and law enforcement that it is an issue we have to take on, because these children are victims. And so I think that that's a huge thing that we have in Florida, that if someone suspects someone of being a victim of trafficking, they can call the abuse hotline, and there will be an investigation on that, and that child will be treated with respect and dignity, and as a victim, not as a perpetrator.
Thank you. Do any other cabinet members have anything they'd like to add? Okay.
This is an excellent question and has been a focus of the Children's Cabinet through the creation of the human trafficking work group that we're working on. In addition to the legislative work that Representative Harold spoke of and the ability to get help for individuals that Director Abramovich noted, one of the things that the Department of Juvenile Justice and the Department of Children and Families are working together in concert is to really start to develop an assessment and an education process, an assessment so that children who may not be forthcoming with the information that they're being trafficked, we will be able to, through our normal assessment processes, be able to start to identify potential victims and direct them into help. And furthermore, we're doing really a national search to develop together the best sort of service in order to put children who have been victimized in this fashion. And our two departments are doing this in concert, and we'll do this, these services together.
Thank you, Secretary. Commissioner Alexa Parsons, please pose your question to the Cabinet.
Throughout the state of Florida, arts programs have been cut due to budget restraints. Numerous studies have shown that arts programs help improve students' standardized test scores and their self-esteem. Arts programs are very important because they not only stimulate the mind, they also give youth positive ways of expressing themselves. According to McCammon and Saldana, in their book, Lifelong Impact, for young people, quality high school speech and theater programming develops teamwork, problem solving, and leadership skills through adulthood. Positive, well-rounded environment for youth. In the state of Arizona, there is a state-fortified endowment entitled The Choice is Art. It is meant to stimulate the arts programs and encourage cultural conversation. Would this Florida Children and Youth Cabinet be willing to review further research and assess the viability of a campaign similar to The Choice is Art, and spread awareness in the importance of art in our schools and after-school programming to help increase the participation in arts programs?
First of all, let me congratulate your parents, other caregiving adults, your teachers, superintendents, and others who prepared you to a point that you as young people can feel very comfortable coming before decision makers to ask very good questions. Let's talk about the arts. We're definitely on board with you. We know how vitally important it is to education. At the Department of Education, we have a new motto. It says we're supporting colleges, careers, commerce, and creativity. The creativity part is dealing with the arts. We know there are budget cuts, but we have some superintendents in our state who go out to the private sector to support public-private partnerships to support art programs. We also know that we have organizations where there's bush gardens for something that's involved for young people to take place at their site. We also know that the online education community is also playing a role in providing arts education. In fact, the Department of Education is going in partnership with PBS to support their online work along with Florida Virtual Education and a few others to support it. I'm on board with you, and if we want to support arts education, we also have to allow the entrepreneurial spirit in young people to also come out, because many of you are the ones who are going to make us think very differently about how arts education matters. So it's something that we support. We'll find creative ways of doing it through a public and private partnership, and I frankly look forward to your voice helping shape the conversation.
Art education is a very, very important piece in our programming at the Florida Department of Juvenile Justice. And as the mother of an artist, this is something that is personally extremely important to me as well. Last night, I'm very proud to tell you that we had our first art exhibit that displayed the artwork of children in our programs, and it was used as a fundraiser for our Florida Juvenile Justice Foundation in order to fund scholarships. So we agree with you that this is a very important piece in people's lives.
Thank you, Secretary. Do any of the other cabinet members have anything else they'd like to add? Thank you. Commissioner Rachel Floyd, please pose your question to the cabinet.
Last February, at my high school in Land O'Lakes, Florida, widespread grief swept across our campus as we learned that one of the most prominent seniors died. Months before graduation, his life was taken from him in an accidental drug overdose. In Florida, the number of deaths from prescription drugs averaged 16.5 per 100,000 people, which isn't surprising, as Florida dispenses more oxycodone in 1 year than all the other 49 states combined. While our state has now implemented an online database to keep track of prescription drug records, pain clinics, or as they're commonly known, pill mills, are still open across the state. What is the state's plan to further implement this program to protect Florida's youth?
Thank you. That's a great question. When I arrived here last year, I wondered what epidemic I, as a Surgeon General, would face. Would it be something like the smallpox epidemic of the late 1800s, or the yellow fever epidemics that swept through the port cities? Instead, I came up here and I found that we had an epidemic that did not really fit the traditional definition of an epidemic. We had a prescription drug abuse problem that was killing 7 to 8 people a day. That was an epidemic. That was my epidemic as a Surgeon General, and I recognize that, and I've made that a top priority to attack that problem. We have shut down numerous illegitimate pain clinics. And I want to say, first of all, and I always say this, there is a legitimate need for pain medication, and there's a legitimate need for people to get pain medication. We're talking about the illegitimate, the people who open up their clinics that have no intent to diagnose, to treat a patient. They have one intent, to give a prescription, illegitimate, that's going to be used illegitimate or sold on the streets. And these are the people that we're going to shut down. Last year, when I arrived, we had 90 people in the 90 of the top 100 oxycodone distributors in the United States resided here in Florida. That number is now down to 11. We have closed, I think, over 300 various physician's office, pain clinics, things of that nature. We've set up a separate emergency suspension order in order to address this problem. We are going to win this problem. It's going to take a number of years, because it took a number of years to get where we are. We are going to win this problem.
Thank you, Dr. Farmer, on that point. And I really do believe that the enforcement that the state has been focusing on over the last year and a half is truly making a difference. I also wanted to mention on the treatment side, I mean, we have seen the issues, particularly in the Department of Children and Families, around substance abuse is now at a catastrophic level. We see, particularly in our child welfare system, substance abuse issues is the #1 reason for child abuse and neglect, and is the situation that our